Hello, I'm Mr. Smith. I'm 80 years old, retired, and I live alone. I lost my wife a few years ago, and my only son moved across the country 10 years ago. I've been on my own for a while now. Things are going fine, but I've been starting to move a bit slower when I go about my day. It takes a bit longer for me to get to the front door for my morning paper, but I still look forward to reading about current events. I also like skimming through the entertainment section. I started moving slower in the mornings because my feet have been feeling tender and I've been getting cramps in my legs when I walk for too long or climb the stairs. I don't worry about this too much though, since the cramping goes away after I rest for a bit. That allows me to take care of everything I need to do, but I'm worried that my daily routine is going to get too difficult over time. One thing I noticed recently is how hard it is to dry my feet after a shower. I just slip my wet feet into my slippers after I have my shower. My feet end up drying nicely that way. I've also had a hard time focusing on the small font when I read the morning paper. It's pretty blurry these days. My son keeps telling me to go digital, but I like the feel of the paper in my hands. I was talking with my son a couple of weeks ago, and he was suggesting I get my feet checked. He said, "You don't take care of yourself since Mom died." I told him that isn't true. I have diabetes, but I eat well every day. I don't love cooking, but I do manage to make some soups and sandwiches with lunch meat, lettuce, and pickles for supper. I don't always sit down for 3 meals a day, but I snack throughout the day, so I'm always well fed. I ended up taking my son's advice and called the home care people. They're coming around this week to review my medications and look at my feet.
Hi, my name is Greg, and I am Mr. Smith's home care nurse. My scheduled visit to Mr. Smith didn't go according to plan. When I arrived at his home around 9:30 in the morning, I heard him yelling, telling me that the door was open and I could come in. I looked in and identified myself before I entered. As I entered the kitchen, I saw that Mr. Smith was lying on the floor, telling me he fell down after tripping on the kitchen rug. I conducted an initial assessment and didn't see any external head injury or loss of consciousness. However, his back and legs were sore, and he couldn't get up off the floor without my help. I also noticed that the skin on his legs was shiny and he had weak pulses in both feet. Once Mr. Smith was seated in the kitchen, we had a chance to talk about his situation. He told me that he's been having trouble focusing lately and finds it difficult to read his newspaper or see faraway objects. He's also seen dark, floating objects in his line of vision, sort of like cobwebs. After we had our chat, I told Mr. Smith that he should visit his doctor and discuss his recent health changes and review how he manages his diabetes. This would involve getting a doctor's referral to see an occupational therapist. That person could determine what type of equipment Mr. Smith should have in his home to help with his activities of daily living, general mobility, and safety. I also conducted a foot assessment and helped Mr. Smith set up an appointment to get his referral. After we agreed on the plan, I arranged a follow-up so I could review the results of his visit with the occupational therapist.
Hello, my name is Mallory. I'm the pharmacist who helped Mr. Smith. When he was visiting our pharmacy, Mr. Smith approached me to have a conversation about his health. We spent some time discussing the importance of taking medications at set times throughout the day. I also told him that blister packaging is a good solution for his medications, as it visually reminds him whether he has taken his medication or not throughout the day. We talked about his diabetes and what he should do if he ever shows signs and symptoms of hypoglycemia. Then we discussed his vaccination history, since he's at a higher risk of influenza, pneumococcal infection, and shingles. Based on everything we talked about, I recommended antibiotics for the soft tissue infection in his feet.
Hi, I'm Kelly, Mr. Smith's optician. When Mr. Smith came to our clinic for an eye checkup, I assessed his eyes and concluded that he likely has a retinal detachment or diabetic retinopathy. I strongly suggested that he see an optometrist or eye doctor for immediate care. An eye doctor will likely consider one of two options: either reattach Mr. Smith's retina or help him manage his diabetes to prevent his retinopathy from getting worse. If the doctor decides that diabetes management is the best option, Mr. Smith can visit the optometrist or optician to get a new refraction and order new eyeglasses. If there is permanent damage from the retinal detachment, the optician can also recommend some low vision aids to help Mr. Smith use his remaining vision more effectively. These aids might include magnifiers or projectors to help with reading.
Hello, my name is Danny, and I am a diagnostic medical sonographer. Many people think that sonographers only do prenatal ultrasounds. And although obstetrics and gynecology is one of the more common areas we work in, we also take images of other areas of the body too. In this instance, Mr. Smith needed a vascular ultrasound. He was assessed in the vascular lab to investigate possible lower extremity peripheral arterial disease. We performed an ankle brachial index, or ABI, and Doppler sonography. The ABI revealed posterior tibial and dorsalis pedis waveforms, indicating abnormality. This confirmed the presence of lower extremity peripheral arterial disease. This is a common complication in patients with type 2 diabetes. When diagnosed quickly, we can initiate early treatment which can prevent further complications. This is extremely important, as poor blood perfusion to the legs can lead to amputation.
Many health professionals came together to create a care plan that meets my needs and keeps me doing the things I love. I am so grateful for their care and attention.